And now, Living Well with LDS Hospital.
I'm so excited to be joined by Lupe Cruz here from LDS Hospital. She's a certified nurse midwife. Let's talk about that exam that lots of people are going to be getting before they get married. They get a little bit nervous about it. What is this exam?
This exam, it's a physical exam that you want to have done probably about 3 to 4 months before you get married. And some of the things we're going to do to get a complete physical, you want to also discuss contraception if you're not planning on getting pregnant right away. If you are planning on getting pregnant right away, you're going to want to discuss preconception, so vitamins that you should be taking, ways to take care of your body to improve your chance of having a healthy pregnancy and a healthy newborn.
So what can somebody expect when they're coming to that first exam?
There's a lot of counseling involved. There will be a physical exam. Doesn't always involve a pap smear or a pelvic exam. And actually the pap smear doesn't happen until you're 21. Or, you know, after 21 if you're not sexually active at that time. That's what we're looking for. We're looking for HPV and abnormal cells. So if you haven't been sexually active, it's kind of pointless to do that. So.
I feel like lots of people are nervous to go to that first exam if they haven't ever visited. Like, because what sort of doctor would you go to for this exam?
You could go to your OBGYN, you could go to a midwife or a women's health nurse practitioner. Even family practice providers can do that for you.
And if you're feeling nervous, what is your advice to a patient who would be coming in who's kind of putting it off thinking, I don't want to do that. That sounds too uncomfortable. I just don't want to do it.
I think the reason that people are uncomfortable about it or are afraid to go is because they're expecting a full pelvic exam. And for someone who's never been sexually active, that is frightening. And rest assured, it's not always what we do. In fact, I kind of lean more towards the counseling part and just letting people know what to expect. You want to have a good honeymoon, a comfortable honeymoon. You don't want to be running from your spouse because you're uncomfortable and because you've never been sexually active. So that's something to talk about. You want to know what to expect. And also another thing is how to prevent urinary tract infections.
Oh yeah, that's a great thing because I feel like lots of people aren't expecting, and sometimes that could be a huge issue even on your honeymoon.
Right.
So what's advice you give to a patient that comes in?
So one of the things is when someone becomes sexually active, it introduces bacteria into the urinary tract, which is what can cause the infections. So going to the bathroom, so urinating after intercourse is a really good way to clean that area after intercourse. Drinking lots of water. You know, when people go on their honeymoon and they're going somewhere, a lot of times they don't get that fluid intake that they're normally used to. So drinking plenty of fluids is a really great way as well. And then just, you know, you can shower afterwards or just clean the area afterwards, and that would help as well. But urinating is one of the really good ways to keep that area clean.
Okay, well that's a great tip to know. I love that you said before 3 to 4 months ahead of the wedding is when they want to be coming in for their premarital exam. Why so early?
Well, we want to try whatever the contraception that the patient wants to use. We want to make sure that they're okay with it. If someone says, you know, I want birth control pills, and they take the birth control pills, I've had people come back and say, nope, that did not work for me. And so we want to try something else. You want to have that amount of time to try what you want and to see what works for you.
Okay, that's such great information. And I love that people can really come in and view it, as you said, as a counseling session, getting advice from you. Things, questions answered that you don't always know the answer to, and you need a medical professional to answer it for you. So if people want more information about this or how you can get in touch with LDS Hospital, be sure to visit our website. You can also go, it will be linked to their website, to intermountainhealthcare.org, and all the information will be up there, and you can find a good provider. What about people who have never been to an OB? What's your advice to find a good provider for them?
You know, sometimes whoever your sister or your mother has gone to, you can also go on a lot of forums and see what people think about different providers.
Great advice. Thank you so much, Lupe, as always, for being here. Brian, what's coming up?